Chapter 5, The Newborn. This chapter examines the characteristics and developmental patterns of newborn infants. During the first 3 to 4 weeks after birth, infants have a unique look, sound, and feel. Certain physical characteristics of newborns are typical, and newborns assume growth patterns that are predictable and significant. The newborn has many reflective and psychological states. Their need for sleep is great, and sleep patterns reveal important information about the baby's development. Newborn infants are more helpless and fragile and dependent than they will ever be again. Newborn infants have continual needs for nurturance and subsistence, and some new parents are not fully prepared for the demands of life with a neonate. There are cultural variations in the care and nurturance of newborn infants, and these are important for the early childhood professional to know and understand. There are 6 critical concepts. Critical concept number 1. Newborns have unique appearances with tiny features, disproportionately large heads, and a look of vulnerability. Right after birth, they may have puffy features and misshapen heads. Critical concept number 2. Newborns spend their time in a narrow range of psychological states. They sleep for many hours. When awake, they cry and eat. 2 particularly important states are the alert and waking periods, during which newborns visually explore the world and the people within it. Critical concept number 3. Breastfeeding is found to have significant and helpful benefits for both infants and their mothers. Children who breastfeed have a lower incidence of serious illness, tooth decay, and childhood obesity. Mothers who breastfeed show a higher quality relationship with their infants and are less likely to be afflicted with breast cancer. Critical concept 4. During waking states, newborns habituate to familiar sights and sounds. That is, once they come to know something, they grow disinterested in it. They become excited with new objects, appearances, and new events when new objects appear and new events occur. Critical concept number 5. The time newborns spend in various states and how quickly they habituate to new stimuli vary from one ethnic group to another. This may be partially due to genetics. However, parents of diverse backgrounds respond in unique ways to newborn states. For example, some parents respond quickly with warmth and feeding when babies cry. Others are slower in responding and use distracting techniques. These differences in interactions may explain some of the diversity in infant states and behavior. Critical concept number 6. Some newborns may be at risk for poor development. Low birth weight infants can suffer poor developmental outcomes, particularly if their families are living in poverty. Genetic disorders and illnesses may also threaten healthy development in the earliest days of life. Some problems stem from barriers to health care for families of historically underrepresented groups.